the Caregiver Connection podcast by Best Care, where we dive into new topics each week, drawing inspiration from our insightful and educational blog posts. We're committed to providing valuable information that impacts both home care clients and caregivers. Without further ado, let's jump into this week's episode. Scam Prevention for Seniors, Understanding the Caregiver Role in Digital Security. People have functioned as caregivers for centuries, and the role has certainly evolved over the years. Today, supporting a loved one often extends beyond physical care to include navigating the digital world on their behalf. This can mean managing digital accounts, paying bills online, accessing telehealth portals, avoiding common scams that target the elderly, and much more. With these new responsibilities come another modern need: protecting your care recipients' personal information and digital security. Seniors, in particular, are disproportionately targeted by online scams and cybercrime, making digital safety a critical component of caregiving. This guide will walk you through the 5 most common scams that target seniors, as well as practical strategies for keeping your loved ones safe online. Understanding the digital risk for seniors. According to the FBI, older adults are among the most frequently targeted groups online for fraud and identity theft. Cybercriminals often prey on seniors because they may be less familiar with evolving digital threats, more trusting of official-looking communications, and less likely to report breaches. Threats come in many forms, including fraudulent emails, fake phone calls, deceptive websites, and dangerous text messages designed to look legitimate. Awareness is our most powerful tool as a caregiver watching over the digital health of your loved one. Scam Prevention for Seniors, Recognizing the Warning Signs. Scam prevention always starts with education. As a caregiver, familiarizing yourself and your loved one with common scam tactics can prevent significant financial and emotional harm. The 5 most common scams targeting seniors include the grandparent scam. How it works. This fraud exploits emotions. A caller impersonates a grandchild and asks for financial support for rent, a medical emergency, car repairs, or to post bond. Or the caller pretends to be an authority figure helping the grandchild, such as law enforcement, a healthcare professional, or a lawyer, and asks for money ASAP. In an age of AI, these scammers are even more undetectable, since they can clone real voices to trick unknowing adults. How to spot the scam. The requested payment method is often unusual, such as gift cards, cash apps, wire transfers, or insisting that a stranger will stop by the house to pick up the money. The caller will insist on both urgency and secrecy, insisting that no one else can know what's happening. How to react. Hang up the phone and directly call the grandchild or reach out to another family member to ask if they know where the person is. A family code word is another good strategy. Pick a word that only people in your family would recognize as a safe word so fraudsters cannot successfully impersonate loved ones. Financial scam services. How it works. Someone pretending to be from a bank, Social Security office, or debt collection agency calls, texts, or emails the target. Often, the scammer claims that a financial account has been compromised and asks for personal information, Social Security number, bank password, etc., to secure it. Other times, they threaten arrest for an unpaid bill that you didn't know about. Another angle is asking for upfront fees in order to access a loan or prize. How to spot the scam. Just like the grandparent scam, the fraud will often require an unorthodox payment method, such as a gift card, cryptocurrency, cash app, or wire transfer. Urgency is another red flag, with the scammer insisting on immediate action. You may be promised a too good to be true prize or investment opportunity that requires you to act quickly. Many scammers will instruct the recipient not to talk to family members or their bank. All of these are signs that the situation is a scam. How to react. Even if the phone number or email address looks legitimate, remember that scammers can spoof this information. They can even make it look like a call is coming from your bank. Your best course of action is to slow down and not take any immediate action. Call your financial institution directly to see if they are the ones reaching out. Never provide personal information or money to someone whose identity is unverified. The tech support scam. How this one works. Many older adults aren't tech savvy, so when a pop-up suddenly appears on their computer with instructions to call tech support because there has been a security breach, locked computer, or virus infection, they are more likely to fall for the scam. This phone number goes to a fraudster who talks the victim into providing remote computer access and/or a fee to fix the problem. How to spot the scam. Legitimate tech companies do not operate through scary pop-up messages and will not instruct you to call an unknown number. Any alerts that come up this way are not real. Just like the earlier scams mentioned, another red flag is the unusual payment method requested. Cash App, cryptocurrency, gift card, etc. How to react. Do not call the number or click the link. If your computer screen is frozen, force close all programs using Control plus Alt plus Delete or Command plus Option plus Escape and restart the computer. Never let a stranger access your computer remotely. The government impersonation scam. How this one works. Getting a communication from an official sounding source, such as an IRS agent, Medicare, or the Social Security Administration, can immediately stress anyone out. Scammers capitalize on feelings of panic by impersonating a government official and demanding payment for taxes or asking for personal details under the threat of canceled benefits. How to spot the scam. The IRS, Medicare, and Social Security Administration will never initiate contact by phone, text, or email to demand immediate payment or threaten legal action. As with the other scams, unusual payment requests are also an immediate red flag, as no legitimate government agency will ever ask for payment via cryptocurrency, gift card, Cash App, or a wire transfer. How to react. Do not provide any personal information and do not make any payments. Hang up the phone or delete the email. If you are concerned the communication may be legitimate, look up the official phone number for the relevant agency and call them directly. Never use a phone number provided by the person contacting you, as it will reroute back to the scammer. The romance scam. How this one works. Scammers create convincing fake profiles on dating apps and social media platforms looking for lonely people to target with affection. They typically claim to be working overseas. Once trust is established, they make up a crisis like in a medical emergency, legal trouble, or a missed flight home and ask for money. Romance scams can drag on for months or even years, with victims believing they're in a real relationship. How to spot the scam. This online relationship moves unusually fast, with the scammer professing strong feelings early on. They always give a reason why they can't meet in person or video chat, and may ask to move communication to a private messaging app. Over time, the stories may shift or contradict each other. Any request for money is a serious warning sign. How to react. Never send money, gift cards, wire transfers, or cryptocurrency to someone you have not met in person, regardless of how well you feel you know them. If something feels off, do a reverse image search on their profile photo to check whether it appears elsewhere online. Talk to a trusted family member or friend about the relationship, because an outside perspective can often spot manipulation. If you believe you or your loved one is being targeted, approach the conversation with compassion rather than judgment, as victims of romance scams are often deeply emotionally invested. Web security best practices. After you have familiarized yourself and your loved one about the scams that commonly target seniors, the next step is to secure their online presence with the following cybersecurity requirements. Number 1, follow password management tips. Strong password practices are foundational to online security. Savvy password management can help protect your loved one's accounts from unauthorized access. Use unique, complex passwords for each account, combining uppercase and lowercase letters, numbers, and symbols. Avoid easily guessable information like birthdays or names. Consider a reputable password manager, a secure application that stores and generates strong passwords, so neither you nor your loved one needs to memorize multiple complex credentials. When setting up or managing accounts on behalf of a care recipient, document login information securely and store it in a safe, private location. Don't use an easily accessible notebook or unsecured digital file. Review account access regularly and remove any outdated or unnecessary login credentials. Number 2, enable two-factor authentication. Two-factor authentication adds an essential second layer of protection to online accounts. When enabled, logging in requires both a password and a secondary verification, which is typically a code sent via text message or email. Make sure you're able to 2FA on all important documents, including email, banking, and healthcare portals. Number 3, how to protect personal information online. If you are helping your loved one manage their financial and health matters, make sure you and anyone else assisting with these tasks follow these 10 cybersecurity best practices. Number 1, keep the devices you use updated with the latest software and security patches. Number 2, always install reputable antivirus software on computers and tablets. Number 3, avoid public Wi-Fi networks for sensitive transactions like online banking. Number 4, make sure home Wi-Fi networks are password protected with strong credentials. Number 5, log out of accounts after each session, particularly on shared devices. Number 6, be selective about which websites and portals you use, sticking to established, verified services for the tasks like bill payment and prescription management. Number 7, when using telehealth portals, verify the platform is legitimate before entering any health information or insurance details. Number 8, look for secure website indicators such as HTTPS in the web address and a padlock icon in the browser bar. Number 9, never access healthcare or financial accounts through links sent via email. Instead, navigate directly to the provider's official website. And finally, for bill payment, consider setting up automatic payments through verified banking portals rather than responding to paper bills or email invoices, which can be more easily replicated by scammers. Balance digital support with respect for privacy. Supporting a loved one's digital security requires sensitivity and clear boundaries. Stepping in to help protect someone's online presence is an act of care, but it's important to respect their autonomy and privacy in the process. Have an open and honest conversation with your care recipient about digital support you're providing. Explain why certain security measures are being put in place and, where possible, involve them in the process. The goal is empowerment, not control. As a caregiver, you can help your loved one feel confident and safe navigating their digital world. At Best Care, we are here to help with all your questions related to family caregiving, including navigating the evolving responsibilities that come with supporting a loved one at home. Reach out to our team to learn more about the comprehensive support we provide to caregivers and care recipients throughout Minnesota. If you find this podcast helpful, share this with a friend, leave a review, and don't forget to subscribe. Contact us today for expert guidance and support. Visit bestcaremn.com. Thanks for listening to the Caregiver Connection.